In the meantime, the National Association of Nigerian Nurses and Midwives, Federal Health Institutions sector, has refuted claims that it has suspended its ongoing nationwide 7-day warning strike. In a statement, the association clarified that the industrial action, which commenced on Wednesday, remains in force. The union said it would only review its stance after assessing the government's offers during a closed-door meeting with the Coordinating Minister of Health and Social Welfare, Pate, held on Friday. National Public Relations Officer of the association, Omomo Tibiebi, and National President Rilwan Morakinyo both affirmed that no decision had been taken to call off the strike. The warning strike was declared to press for long-standing demands, including a review of shift and uniform allowances, creation of a distinct salary structure for nurses, adjustment of core duty allowances, mass recruitment of nurses, and the establishment of a Department of Nursing Services within the Federal Ministry of Health. Joining us via Zoom to give more insights on this is the National Chairman, National Association of Nigerian Nurses and Midwives, Federal Health Institutions Sector, Omomo Morakinyo. Good evening and thank you for joining us on News Hour tonight on Trust TV.
Good evening.
Good evening. Thank you for joining us. We seem to be having different news and information coming on from different sides. The Minister of Health is saying strike is being called off, and your people are saying the strike isn't called off. What is the true position of things?
Okay, thank you. Thank you very much. The meeting was actually concluded with the Honorable Minister by the leadership of the association, but they have to come back to the National Executive Council meeting for feedback so that we can review the outcome of the negotiations to either to suspend the strike or to sustain the strike. So the strike is not yet suspended.
Okay, so the stance of the association is that the strike is still in force and not yet suspended.
Yes.
Okay. Now, in the meeting so far, what could you tell us? Were the suggestions and the discussions had with the minister, did it meet the demands or the reasons that this strike was called for?
Oh, yes, the item on our demand is going to be ratified by the highest decision-making body of the association very soon, probably tomorrow, to do that, to review that.
Okay. Now, how has we noticed some of the videos we've seen so far, what happened in the hospitals when you people went on strike. How has the immigration of nurses, especially moving to other countries, how has this impacted the work of nurses in Nigeria?
It's actually not it's a pathetic situation, which we are actually not happy about it. But fortunately, we don't have any option. That's the last option we have at this particular time, because our demands have been there, reoccurring year in, year out, without any intervention by the federal government. So after exhausting all the avenue to ensure that these demands are met amicably, after serving government a lot of, I think twice, serving government with the notice of strike. But this time around, we don't have any option than to embark on that 7-day warning strike.
So far in the conversation we had with the
we're telling the generality of Nigeria that we are sorry, it's not in our attitude to leave our patients to suffer or to leave them without anybody to take care of them. But unfortunately, this time around, our members are tired and they have to resort to this last option. So we are still assuring them, once the outcome of the meeting, of today's meeting, then we'll get back to the public.
Okay, can you tell us of any agreed timeline from the meeting you had today to so far implement your grievances?
It's going to be to maintain the schedule for tomorrow morning. by God's grace.
Could you repeat that, please?
Pardon?
Could you repeat yourself, please?
The time?
Could you repeat what you said, please? Could you take that
So
again?
I said the meeting. Yeah, the meeting to review that is scheduled for tomorrow.
What I'm asking is, from the meeting you had, you were at the meeting with the Minister of Health today, I believe.
No, I wasn't there. It's the leadership, the highest decision-making body. The leadership were there.
Okay.
I wasn't among them.
Oh, okay. All right. So far, hopefully when the executive committee meets tomorrow, we'll have more information on this agreements that have been put forward on the table. Thank you so much for joining us tonight on News Hour, giving us your insights on the situation.
Thank you very much.